What prompted our move from balloon ablation to the NovaSure ablation procedure was the fact that the women having balloon ablations were getting considerable pain during the procedure, and we weren't getting very good results afterwards. I'd heard quite a lot about NovaSure in various meetings and was very keen to try the procedure because the technology behind it sounded very interesting.
I've used the NovaSure now over the last 3 or 4 years, and we have done over 100 patients. And the reason why I prefer the NovaSure in my current practice, it's simple, it's safe, but it also has some features which are integral in the system which are not present in other techniques. And these include the cavity integrity assessment system, and it also, from a clinical point of view, one can measure cornea to cornea, which is not existent in other procedures. The other thing I like about it is the differential gradient in the thermal energy that the energy is dissipated along the endometrium, which again, with other devices, whether they are earlier techniques or second generation techniques, they do not take into account appropriate and effective treatment of the cornea. And the other thing I like about it is that it's very simple to use as a clinician.
Well, I wrote a book recently, and I was reviewing the current ablative devices to find out which ones have potential for use in the outpatient, because there isn't a huge amount of data available. What attracted me to the NovaSure system was the fact of its speed primarily, and simplicity. I think that is, if you like, the main initial attraction for me and advantage. But then when we looked at the outcomes in terms of amenorrhea rates, these were very good. We looked at the safety features in terms of the cavity integrity assessment. Again, these were very good. And the fact that although you need to dilate the cervix to Hagar 8, I don't think people should see that as a barrier, because I think, again, as we demonstrated today, generally it's quite easy to dilate most women up with an adequate cervical block to Hagar 8, and that includes women who have had cesarean sections or biopsies on the cervix. And so really for those reasons we were attracted to it, and the fact it's so quick and simple, easy to use, and the results, as I say, that I'm getting in the outpatient are the same as I'm getting with my inpatients, that I feel that I have to offer my patients both settings with the NovaSure system.